The average response time for ambulance dispatch in Kenya is 2 hours. That's way beyond the golden hour. And so some of the things I looked at is how do we reduce those 2 hours to 15 minutes? So Ambulex Solutions, basically it's in our name. We provide solutions around emergency medical issues. Typically when you call us for a response, the person who will pick your call will assess your situation and they will determine whether you need online first aid. So basically to just take you through what to do, because sometimes you find that you don't actually need to go to a facility. Or they will determine whether we'll send someone with a motorbike, an EMT or a paramedic on a motorbike. And that one mostly happens when you actually use the app. An EMT with a motorbike will get to you and they will assess your situation and stabilize you if there's need. And if they assess and they find that there's need for you to be transferred to a facility, then they'll call the closest ambulance. We have more than 202 ambulances currently in our network and more than 60 paramedics in our network as well. Yeah. So that's what makes us different. We are very keen on first getting to you as fast as possible. I did a lot of work in the non-profit space, and I mostly worked with women, girls, just ensuring access to healthcare, but also commodities. And so this time I was in one of these areas that I was working in. It was 11 a.m. I think around, and this woman, she had been stabbed by the husband 7 times. And I tried getting an ambulance, calling some of the service providers, and the one that agreed to respond wanted some down payments. And then they were like, and the ambulance is 45 minutes away. So I imagined with the traffic, probably 2 hours. So unfortunately, she didn't make it. There was some good Samaritan who agreed to take her to the hospital using their car. But then they didn't even go past 300 meters. She died. And so that really led me to start thinking. I watch a lot of movies and you see the way a response is done, how ambulances are sent in, the cases of, in the US. Why can that happen in Kenya, And yeah, the reality is that we are a developing country. We have so many gaps, so many things are not working for us. And so I think it was just recognizing that there are challenges, then how do we work around those challenges? The average response time for ambulance dispatch in Kenya is 2 hours. That's way beyond the golden hour. And so some of the things I looked at is how do we reduce those 2 hours to 15 minutes? Beyond that, it's quite expensive for anyone who is living below $5 a day. And then it was $3 a day. So that Mama Mboga, that Juakali guy or the construction worker who is probably earning just that $5, how do we reduce the costs of access for this person? And so that's how we came up with Ambulex, where within 15 minutes of your call, there's either an ambulance or an EMT giving you life-saving services. When I started, I was the CEO, I was the accountant, I was the dispatcher. I was not sleeping. I think I would get like 2 hours of sleep every day. And I didn't think I would make it. I didn't think I would get to a point where I could actually get resources to onboard people who could support some of those functions. I think for about a year or so, I was doing a lot of work. And at some point I was like, do I really want to continue with this? Is this really the kind of life I want to take? And then I was broke. Did I make a good decision, a right decision when I resigned from where I worked to go into entrepreneurship? Because I really believed in my idea, and what I didn't know is that it would take me a bit of some time for it to actually pick up. it was tough, but knowing that we actually do save lives, that gives me some joy. We are going to, I think, provide employment to more than 10,000 people. I'm talking about paramedics and EMTs. You know, every other year, there are paramedics that are graduating, there are EMTs that are graduating. So you can imagine that massive job market that we are creating and facilitating. It's exciting. And more exciting is that we are actually saving lives. You know, we've done a lot of work with maternal health and also GBV. And I'm more excited and happy about the work that we've done with GBV. You'd be surprised that most people who actually place calls for GBV are men. And so that narrative, I would not say necessarily that it's changing, but it's improving so that men also know that they can call for help in GBV situations. Yeah, so it's exciting the kind of work we have laid ahead for us. Hi, my name is Judith Awuor Oketch, founder and CEO of Ambulex Solutions Limited, and that has been my record. To learn more about what we do and how you could support, find us at www.ambulexsolutions.org. You can also follow us on our socials, Facebook at Ambulex, X at Ambulex Solutions, and also on TikTok at Ambulex.